What if your fingernails could warn you about a stroke before it happens? No blood tests, no fancy machines. Just a quick look at your hands. Today, I'll show you the 5 nail changes that can reveal a stroke risk in seniors, and what you can do to protect your brain, starting now. I once treated a 72-year-old man who thought his brittle, pale fingernails were just aging. Nothing serious, nothing worth worrying about. Then one morning, he woke up dizzy, unsteady, and barely able to speak. And what shocked him most wasn't the stroke. It was learning his fingernails had been warning him for months. I'm Dr. Howard Tucker, neurologist and longevity physician. Today, I'm joined by Dr. Shigeaki Hinohara, Japan's legendary physician and global longevity expert. Together, we'll break down the 5 nail changes every senior should watch for. We'll explain the science, share real stories, and give you practical steps to protect your brain and your independence. Why nails matter. 2:30 to 4. Seniors ignore their fingernails because they think nails are cosmetic, but the nail bed is one of the first places blood flow, oxygen levels, and vascular health begin to show distress. Before the big warning signs appear, drooping face, slurred speech, those are late. The fingernails whisper the truth, and most people never hear it. Stroke signs don't begin with dramatic symptoms. They begin quietly, in the color of the nail, in how fast it grows, in ridges that appear out of nowhere, in pale, weak, or spoon-shaped nails that reveal oxygen problems, circulation issues, and even micro-clotting. Once you understand these signs, you can act early, long before a stroke ever occurs. Let's start with the first sign seniors tend to overlook: pale or washed-out fingernails. When the nails lose their natural pink tone, it means blood isn't reaching the nail bed with the strength it should. If circulation is weak at the fingertips, it's usually weak in the brain as well. I've seen seniors walk into my clinic with nails so pale they looked almost chalky. And the moment we improve their blood flow, their nails change before anything else. It's one of the earliest, clearest clues the body gives us. Why does this happen? The nail bed is incredibly sensitive. When oxygen drops even slightly, the color fades. When blood vessels narrow because of inflammation or plaque buildup, the nails lose that healthy glow. In Japan, we often teach seniors to check their nail color every morning the same way they check the weather. Because pale nails are not cosmetic, they are vascular. And when you catch that early, you can restore circulation long before the brain suffers. Don't compare your nails to someone else's. Compare them to your own baseline. If you've always had pink nails and suddenly they're pale, that's a red flag. If you press the nail and the color takes longer than 2 seconds to return, that's another sign blood isn't moving the way it should. When circulation slows, the risk of clotting increases, and that's where stroke becomes a real threat. Now, let's talk about the second warning sign: vertical ridges on the nails that suddenly become deeper, sharper, or more obvious. These ridges are not random. They happen when the body is fighting chronic inflammation beneath the surface. And inflammation is one of the strongest predictors of stroke after 60. When I see nails with pronounced ridges, it usually tells me the blood vessels are irritated and the arteries are under stress. It's the body whispering that something is wearing down the circulation system long before the brain begins to feel it. Seniors often tell me, "Oh, doctor, my nails have always had ridges." But I tell them, it's not about having them. It's about when they change. When ridges go from faint to deep, that's when the body is signaling trouble. The reason is simple. Nails grow from the matrix, a tiny factory under the skin that depends on healthy blood flow, oxygen, and nutrients to produce smooth keratin. When inflammation builds inside the body, the matrix becomes disrupted. Instead of growing smooth layers, it grows uneven ones, which show up as ridges. In Japan, we've observed that seniors with high inflammatory markers often show these nail changes months before developing more serious symptoms. It is like reading tree bark. Deep grooves tell you the environment has been harsh, and the same is true for the nails. They tell the story of stress, inflammation, and sometimes even early vascular damage. Chronic inflammation rarely hurts, and it doesn't cause pain. It doesn't cause fever. It works silently, irritating the lining of the arteries and making clots more likely to form. These vertical ridges are one of the few visible clues. When ridges become deeper on only one or two nails, especially the thumb or index finger, it can indicate inflammation on one side of the body or narrowing in a specific artery. When they appear across all 10 nails, it usually means whole body inflammation, often related to diet, stress, poor sleep, or chronic high blood pressure. The uplifting part is that ridges often soften when the inflammation calms down. Seniors who improve hydration, increase omega-3 intake, reduce processed foods, and add gentle movement often see their ridges fade within weeks. The nail will begin growing smoother from the cuticle downward. The next warning sign is the one seniors notice most, but understand the least. Nails that start shifting color in ways that don't make sense. Bluish, purplish, gray, or even staying unusually white at the base. These color changes are some of the clearest indicators that oxygen delivery to the tissues is dropping. When the brain isn't receiving steady oxygen, stroke risk rises dramatically, and the fingertips reveal this long before the rest of the body. I once had a patient who said his nails looked cold even when he felt fine. Within weeks, we found his oxygen levels falling due to poor circulation. That's why nail color matters. Healthy nails have a warm pink tone. When that tone fades or shifts, it's not cosmetic, it's physiological. Nail color is a reflection of blood quality, oxygen saturation, and vascular stability. In Japan, we tell our seniors that the nails are tiny windows into the bloodstream. When the nails turn blue or purple, it means the blood is not carrying enough oxygen, or it's not reaching the fingertips quickly enough. This often happens when the arteries stiffen, when blood pressure is unstable, or when the heart is struggling to push blood upward. If the nails turn gray or dull, it often means the red blood cells are not delivering oxygen efficiently, sometimes from anemia, sometimes from chronic stress that reduces microcirculation. And when the nails stay white, even at the base, it can reveal early signs of micro-clotting or reduced blood flow to the small vessels that feed the nails. These color changes often show up before shortness of breath, dizziness, or fatigue. The fingertips are the far end of the circulation line, so they show distress first. If the nails are blue in cold weather but turn pink again when warmed, that's usually circulation reacting normally. But if the blue or purple shade stays even when you're warm, that's a sign blood isn't reaching the brain with the force it should. The same goes for nails that look unusually white or milky. It means the nail bed isn't being filled with oxygen-rich blood. When we see that consistently, we look for deeper vascular issues. The hopeful part is that nail color often improves quickly when circulation improves. Seniors who start gentle daily movement, hydrate consistently, increase iron-rich foods, manage stress, and improve breathing habits often see their nails brighten within days. That's why I tell seniors not to fear nail color changes, but to treat them as early invitations to support their arteries and oxygen flow. When the nails return to healthy pink, it often means the brain is receiving stronger, safer blood flow as well. Now, let's talk about something most seniors never think about at all: how fast or how slowly your nails grow. Healthy nails grow at a steady pace, about 2 to 3 millimeters per month. When nail growth suddenly slows, stalls, or becomes inconsistent from one nail to the next, it usually means the body isn't delivering enough nutrients, oxygen, or blood flow to the nail matrix. And here's the important part: the same arteries that feed the nails also feed the brain. So, when nail growth slows down, it often mirrors what's happening inside the arteries leading to the brain. I tell my patients to pay attention when their nails feel like they're taking forever to grow, because that often means something deeper is slowing too. The nail matrix is extremely sensitive to the supply of nutrients like biotin, zinc, iron, and essential fatty acids. But even more importantly, it depends on strong microcirculation, the tiny vessels that bring oxygen to the fingertips. When those vessels weaken, nails grow thin or slow, and the brain receives fewer nutrients as well. In Japan, we watch nail growth closely because it changes long before blood tests show trouble. When nails grow slowly, we think about hidden anemia, chronic inflammation, low protein intake, or stiffened arteries. And when one nail grows much slower than the others, it can indicate poor blood flow in that specific finger, sometimes reflecting early vascular narrowing on one side of the body. What's encouraging is that nail growth often improves quickly when circulation improves. Seniors who hydrate more, increase protein intake, add omega-3s, walk a few extra minutes a day, or reduce inflammation through diet often see faster nail growth within weeks. That's why nails are such powerful early warning signs. They tell you how well blood, oxygen, and nutrients are moving through your body. When nails grow strong and steady, the brain is usually receiving what it needs too. Now we need to talk about the signs that seniors should never brush off, because these aren't gentle warnings. They are the body raising a flag that something may already be happening inside the arteries. The first one is dark vertical lines under the nails. These tiny lines, almost like splinters, are often dismissed as bruises or minor injuries. But when they appear without trauma, they can reveal micro-clotting or inflammation inside the small vessels. I've seen patients ignore these for weeks, and by the time they came in, their blood flow was already compromised. The next dangerous sign is nails that suddenly curve downward or become rounded like the back of a spoon. This shape change is often tied to chronic low oxygen, heart strain, or lung issues that silently increase stroke risk. These are the signs you never want to overlook, because these changes show the deeper systems are already struggling. In Japan, when we see dark streaks or splinter-like lines, we immediately look at the blood vessels and oxygen levels. These lines can be early indicators of inflammation inside the arteries, or tiny clots traveling through the bloodstream. And when nails begin curving downward, what we call clubbing, it often means the body has been compensating for low oxygen for a long time. The same lack of oxygen affecting the nails is also affecting the brain. Another dangerous sign is nails that separate from the nail bed, lifting up or creating gaps. This often reveals thyroid imbalance, circulation weakness, or infections that strain the heart and blood vessels. When the nail lifts, it means the blood flow underneath is unstable. I want seniors listening right now to understand this clearly. These signs don't mean panic. They mean action. Nails rarely change shape or detach overnight. These shifts happen gradually, giving you plenty of time to respond if you know what they mean. When I see these signs, I immediately focus on improving blood flow, lowering inflammation, and strengthening oxygen delivery. Even simple steps like hydration, walking, deep breathing exercises, and nutrient support can start reversing these patterns. But ignoring them is what leads to danger. Nails are honest. They show what the body won't say out loud. And when seniors learn to read these signs, they catch problems early, far before a stroke occurs. Now, let's talk about what you can do, starting today. First, hydration. Poor hydration thickens the blood and slows nutrient delivery to the nail matrix and the brain. When seniors start drinking enough water, their nails often become smoother and brighter within days. Second, increase protein intake. Nails are made of keratin, and keratin needs amino acids. Without enough protein, the nails weaken, circulation slows, and the brain loses fuel. Third, simple movement. Even 5 to 10 minutes of walking or calf pumping can dramatically increase blood flow to the fingertips and the brain. Movement is medicine, and nails reveal the benefits faster than almost any other part of the body. Fourth, microcirculation care. Support the tiny blood vessels that feed both the nails and the brain. Omega-3 fatty acids from salmon, sardines, or flaxseed oil make blood flow smoother and reduce the inflammation that causes deep ridges or pale nails. Fifth, improve iron absorption. Seniors often become mildly anemic without noticing, and the nails are the first to reveal it. Eating iron-rich foods like spinach, eggs, or beans paired with vitamin C helps restore healthy nail color and oxygen delivery to the brain. Sixth, nail massage. A gentle 2-minute massage at the base of each nail improves blood flow to the nail matrix and stimulates the same vessels that supply the brain. It is small but powerful. 7th, manage stress. Chronic stress constricts the tiny vessels that feed the nails and starves the brain of oxygen. Simple deep breathing, slow exhaling, or relaxing before bed can improve both nail growth and brain clarity. 8th, sleep. When seniors sleep well, their nails grow faster and smoother because the body repairs the vessels during the night. 9th, reduce sugar and processed foods. Sugar fuels inflammation that shows up as ridges, discoloration, and slow nail growth. And that same inflammation damages the arteries that protect the brain. Myth: nail changes are just part of getting old. Fact: many nail changes are early warning signs of deeper problems. Myth: if my nails look bad, it's just cosmetic. Fact: nails are a window into your circulation, oxygen, and nutrient status. Myth: I can't do anything about my stroke risk. Fact: small daily changes, hydration, movement, nutrition, can dramatically lower your risk. Q: how often should I check my nails? A: every week. Look for changes in color, shape, ridges, or growth speed. Q: what if I see a sudden change? A: don't panic, but don't ignore it. Talk to your doctor, especially if you have other symptoms like dizziness, confusion, or weakness. Q: can nail changes really predict a stroke? A: they can reveal circulation problems, inflammation, and oxygen issues that raise your risk. Early action can prevent disaster. Let's recap. The 5 nail changes that can reveal a stroke risk: pale or washed out nails, early sign of poor circulation, deep vertical ridges, chronic inflammation and artery stress. Color shifts, blue, purple, gray, or white, mean oxygen problems. Slow nail growth mirrors slow blood flow to the brain. Dark lines, spooning, or lifting, signs of micro-clotting, low oxygen, or unstable blood flow. Don't ignore these signs. Your nails are talking. Are you listening? Check your nails every week. Stay hydrated, eat enough protein and iron, move your body every day, manage stress and get good sleep. Massage your nails and support your microcirculation. If you see changes, act early. Talk to your doctor. Share this video with someone you care about. Hit like if you learned something new. And subscribe for more honest, science-backed senior health tips. Your brain is your most precious asset. Protect it with every bite, every step, and every glance at your hands. Thanks for watching.